Hi, everyone. Welcome to Healthy Horizons, the podcast where we dissect critical public health issues piece by piece to assemble a healthier future. Join us as we navigate the intricate puzzle of global well-being, connecting the dots and unraveling solutions that contribute to a stronger and more resilient public health landscape. Today, we are interviewing Sunidhi. She is a Master's of Public Health student at the University of Texas at Arlington, and she is here to discuss with us the prevalence of childhood diabetes. So hi, my name is Cristina. Welcome to my podcast. Today, I'm going to be interviewing Sunidhi on the social determinants of type 2 diabetes in children. So welcome.
Hi, thank you.
So to get started, can you introduce yourself and provide a brief overview of the background of your research proposal?
Of course. Hello. I'm Sunidhi Kulkarni, currently pursuing my Master's in Public Health. My research focuses on the social determinants of diabetes in children. My academic journey in public health combined with keen interest in pediatric health issues has equipped me with a unique perspective on this topic.
What led you to focus on the social determinants of diabetes in children in your research?
So the impetus for my research came from observing the rising trend of type 2 diabetes among children, especially in the age group of 2 to 16. This concerning trend, highlighted in the studies like those by Lib et al., stirred my interest. I wanted to dwell deeper into understanding how this disease and social behavioral factors influence the development and management of the same. Specifically, I'm driven by the need to identify key determinants that can aid in better strategies for prevention and management. So, this research is not just about statistics, it's about real lives impacted by diabetes and how their social environment plays a crucial role. So, my goal ultimately is to bring to light these often overlooked aspects and contribute towards effective strategies.
Okay, awesome. Could you share some background on your current understanding of diabetes in children and its prevalence?
So, according to my understanding, I think diabetes in children is once predominantly diabetes type 1, but now is witnessing a significant rise in type 2 cases. Largely, I believe this is because of increasing obesity and lifestyle changes. This epidemiological shift is concerning because early onset of diabetes can always lead to severe long-term complications, which can include cardiovascular diseases and various other kidney problems. So, diabetes in children is no longer just a health issue, but a growing public health concern. The prevalence of this condition reflects broader societal trends and health behaviors, emphasizing the need for public health interventions. So, I believe caring for these issues is vital not only for immediate health of these children, but also for long-term implication on their adult life.
What sparked your interest in exploring the social determinants of diabetes in children specifically?
So my interest in social determinants of childhood diabetes was ignited by the understanding that the disease's prevalence is intricately linked to social and environmental factors. Recognizing the fact that children from socioeconomically disadvantaged backgrounds face higher risk due to factors like limited access to food and physical activity spaces, I was drawn to explore how these social determinants influence health outcomes.
Gotcha. So to talk about the social determinants, can you describe on the specific social determinants you plan to study in relation to diabetes in children?
So my study focuses on various social determinants that significantly impact the incidence and management. These include factors like family income, parental education, and employment status, which often dictate access to nutritious food and healthcare resources. So, dietary habits, particularly the availability and consumption of high calorie, low nutrient food, plays a crucial role in development of obesity and insulin resistance, which can lead to type 2 diabetes. Additionally, I am currently examining the impact of family history and genetic predispositions to metabolic diseases, along with availability and quality of healthcare services, which are essential for early detection and management. Neighborhood factors can also play a role, which would include the safety and availability of outdoor spaces for physical activity.
Gotcha. So why do you believe that these determinants that you just discussed are critical to understanding the prevalence and impact of diabetes specifically in this population?
It is important to understand such social determinants because I believe, especially when it comes to socioeconomic factors, status, it not only affects access to healthcare but also influences lifestyle choices, dietary habits, awareness about disease management. Poorer neighborhoods often lack safe areas for physical activity, and have very limited access to healthy food options, which can increase the risk of diabetes and obesity. Furthermore, children from lower income families might face more stress, which can contribute to poor health outcomes, I believe. Recognizing the impact of these determinants is important for developing effective management and preventive strategies. I believe by addressing these social factors, we can always create targeted interventions which are more likely to succeed.
Awesome. So, as far as the implications and applications of your study, how do you envision your research findings being applied in the community?
So, my research findings could significantly impact community health initiatives by informing targeted interventions for diabetes prevention and management. By identifying the key social determinants, I believe we can guide the creation of policies and programs that can address the root causes of diabetes in children.
Okay, so how do you envision your study impacting the actual community? And what actions or support can the community undertake to address the identified issue?
The impact of this study on community could be profound. It can pave the way for equitable health strategies focusing on reducing disparities in diabetes care and prevention. Communities can support these efforts by advocating for policies that can ensure better access to healthcare and nutritious food, especially in underprivileged areas. Additionally, I believe community organizations could collaborate to create programs which can encourage healthier lifestyles, such as community gardens or fitness activities. These actions can always be supported by our research findings and can significantly contribute to combating the growth.
Awesome. So, your research sounds amazing. What are the next steps or for future research that you recommend? So, what are the next steps of future research or any follow up studies that you have planned?
Sure. The next steps that would involve is expanding our research to include more nuanced aspects of social determinants like cultural influence and family dynamics. We also plan to conduct follow up studies that dive deeper into the interplay between behavioral factors like nutritional education and diet and the incidence of diabetes, of course. This will include exploring innovative approaches to integrate these determinants more effectively into diabetes studies, potentially filling critical gaps in the current research.
Okay, so are there any aspects of the research that you believe need further exploration?
I believe so. There are several aspects that warrant further exploration. For instance, the long-term financial impact of preventive health strategies on healthcare system and families need deeper investigation. Additionally, the study's potential to reduce health disparities and provide equal health opportunities in an area that requires continued focus. By extracting clear, actionable insights from our research, we are aiming to develop groundbreaking strategies for the prevention and management of diabetes in children, with a particular emphasis on diverse population.
Gotcha. So, can you share any advice for individuals interested in conducting similar research in the future?
Of course, for those interested in similar research, I would recommend a thorough understanding of both epidemiology and social sciences. It's essential to approach such studies with a multidisciplinary perspective, which can integrate medical knowledge with an understanding of social dynamics. Also, building a strong foundation in data analysis and research ethics, especially when working with vulnerable population like children, is important. Collaboration with various stakeholders, including healthcare professionals, community leaders, policymakers, can always significantly enrich your research.
So, where can listeners find more details about your research or connect with you if they want to discuss any further about your research?
Sure, I'm available for contact via email, which is ssk8115@mavs.uta.edu. We regularly update our findings and progress, and I could let you know about it more.
So, based on your research proposal, what do you hope to achieve or discover with your research proposal in the end?
So, our research aims to achieve a comprehensive understanding of the social determinants that contribute to the development and management of diabetes in children. We also anticipate uncovering critical insights into how factors such as socioeconomic status, diet, physical activity, family history, and different neighborhood environment can interact to influence the risk and management of diabetes in young population. So this study is basically designed to fill critical gap in our current knowledge and provide actionable insights for better interventions.
Awesome. Okay, well, thank you so much for chatting with me today and for taking the time to come and give insights about childhood diabetes in the community. And this is super helpful. I am so grateful that you came onto my podcast. Thank you so much. And thank you so much for listening. I hope you all have a great day. Thanks.